Hello, my friend. Welcome here. I'm Aimee Esther, and today we have part 2 of my pregnancy Q&A. Filming this at the very end of my pregnancy. We only have a few days left until we meet sweet baby girl, so make sure you're subscribed so you don't miss when I share with you my sweet baby and labor and delivery and all that fun stuff. But today we're talking about pregnancy and my multiple chronic illnesses. Also, I feel like this hat is very fitting for today's video because that's how I feel, permanently tired. If you want this hat, it's linked down below. So last week's video was about pain and pregnancy and specifically what I do for the different pains that I feel and all of that, answering your questions there. Today I want to focus more on specific chronic illnesses and how they affect my pregnancies, how they affect my baby, all of that stuff, because I get a lot of questions about that. I have a lot of chronic illnesses, so if you want to learn about them, links below, but let's just dive right into the questions. So, does fibro make pregnancy pain worse? I had a few questions like this, like is it worse with POTS, or is pregnancy worse with fibro or chronic fatigue syndrome or whatever? I don't know, because I've only been pregnant chronically ill. I found out I had POTS while I was pregnant with my first baby, but I had POTS before I got pregnant, and so I've just only known this. So maybe, I don't know. I mean, I'd probably assume that it's probably more painful with fibromyalgia, but I can't say because I've never been pregnant without fibromyalgia. So the next question is, does POTS get better or worse with pregnancy? I have heard both ways. I've heard some people where their pregnancies, they get better. If you don't know what POTS is or fibro or whatever, I do have videos on all of these on like explaining them. I'm not going to go into the details in this video. This is just a Q&A answering your questions. But if you know what POTS is, you know that your blood is very important when it comes to POTS and how it circulates and whatnot. So some people do find that it's better because you have more blood, and also the blood is trying to get to baby, so I'd assume it's probably trying to pump upwards. However, for me, I found that it's worse, at least it seems like it. With my last pregnancy, I did do a video every trimester about POTS and pregnancy. I will link those down below. I don't remember, I just don't remember my last pregnancy with my POTS and this one, so you'll have to watch those videos to know exactly what I said. But with this one, I would definitely say that my POTS is worse. If I'm not wearing my compression socks, I feel much more lightheaded. I feel like my feet swell instantly. I just feel really terrible if I'm not wearing compression socks. I don't feel great when I'm not pregnant, but it just seems worse being pregnant now. But a lot of people wear compression socks and have issues with blood circulation while they're pregnant. So it could just be that combined with I already have POTS, and so it's just worse. I don't know. For other people, I have heard the opposite. So everybody's different. I guess I should say a disclaimer for this whole video. Everyone's different. We all have different symptoms, even if we have the same chronic illnesses. Pregnancy is different depending on the person, depending on the pregnancy. They're all different. So this is just my experience. This question is, how is labor and delivery different with chronic illness or with your specific chronic illnesses? I think I had someone ask for POTS specifically and someone else ask for fibro specifically. So for me, my labor and delivery, one, I will be doing a video on my labor and delivery. Stay tuned for that because who knows, I could have forgotten some things. But with my last two, I will say I was induced at 39 weeks with both of them. I especially wanted to do that with my first because I was a little nervous not knowing what my body would do during labor with so many chronic issues. Now this one, I feel much more comfortable, like I know what is happening, and so I'm not worried about it. I was in the hospital the entire time for both of my first two labors, and I wore surgical socks while I was in labor to help my blood circulate well, especially once I got an epidural, because I could not move my legs, and so I just get a lot of restless legs, and I'd feel not feel good with my blood circulation. So I would wear surgical socks. The nurse brought me some. And then when I could walk, before I got the epidural, I would just walk and sit down and try to like move around as much as possible, which is why with this one, I'm hoping to not have to be induced and to go into labor on my own so that I can have more movement with the first part of my labor. I know I'm going to get an epidural because I'm a wimp and I just couldn't do it, but it would be nice to go as long as possible with being able to move around, because that was the biggest thing with POTS, is not being able to move once I got the epidural. is it was just really uncomfortable. The second thing is also with the epidural is once I got it, my blood pressure dropped significantly with both of my first two babies, to the point where I think I passed out or almost passed out with my second one. But they were really quick to give me some blood pressure medication to fix that. And so all that was good. But again, this time I'm not that nervous because the scariest part was my blood pressure dropping, and that was with the epidural. So I'm not too worried about it this time. However, I don't live that far from the hospital. So, I mean, worst case scenario, I'm there in a few minutes and they can help me there. Did you have a normal delivery, or do you plan to have a normal delivery? And I don't know what that means, but I feel like there's lots of ways to deliver that I would still consider normal. I personally have never had a C-section. I've always delivered vaginally. Plan to do that this time. So far, baby's in a great position. Everything's looking good. Obviously, you never know what could happen, but everything else seemed to be normal for my inductions at least, and we will see how this one goes. I don't know. I think everything went great. The only differences were the things I mentioned, and those are not that big of a deal, and I'm sure a lot of people who don't have chronic illnesses needed some of those things as well. Okay, next question. Any issues with baby not growing due to chronic illness? No, my babies have all grown normally. I did have some miscarriages, 2 before my first and then 1 in between my first 2, I think. Is that what yeah. I had a few miscarriages. So obviously there was that, but that's different than like, you know, a 30-week-old baby who's not growing right. Miscarriages are much more, I hate to say normal, but they are, which sucks. Besides that, my 3 that have made it to term have all grown normally. Again, everyone's different. However, all of my doctors have informed me that the chronic illnesses that I have specifically do not affect my baby as long as I'm monitoring a few things, like my blood pressure and my heart rate and my blood sugar. Mostly it's listening to my body because I've dealt with these for so long. I'm on my 3rd pregnancy. I kind of know what it feels like when those things are off. And so for me, as long as I am taking care of myself and I'm listening to my body, I talked a little more about this in my last Q&A if you want to watch that one. But when I'm listening to my body, I just know when it needs something, and I have not had anything abnormal with any of my babies. I've been very blessed with that, and I'm so grateful that my babies have not had any issues. All of my ultrasounds have been good. I've never had a scary ultrasound. Every single one has been textbook, honestly. Okay, next question is, does having POTS make you at high risk pregnancy? No, it does not. POTS, at least according to my doctors and the research that I've done, again, talk to your doctor, please. Do your own research, call your own doctor, but according to my doctors and the research I have done, POTS does not create a high-risk pregnancy. It's really, like I said, my pregnancies have been textbook, honestly. I have my chronic illnesses, which creates a little more pain, a little more fatigue, a little more of my normal symptoms, but it does not affect my baby. I have not had any effects on my baby. I, to be honest, have not eaten very well during my pregnancies. I have been very sick, as in just like my normal issues worsening, my muscle aches, my fatigue, all of that. So I haven't done very much. I haven't been super active. I try to keep up with yoga and do a few things to help baby get in the right position and whatnot, but I really have not done anything extra, and my babies have been just fine. Okay, and then we have, let's see, how do you deal with tachycardia in labor and delivery? Are there things you can do to help it? And I know I talked about the surgical socks, the blood pressure medication, and those things, but I also wanted to just add to this to just inform your medical team, the nurses or midwife or whoever is helping you to give birth, of the issues that you have. Because like with the surgical socks, I didn't even think about that, and I told my nurse when I got to the hospital that I had this condition called POTS. This is what it does, this is what it affects, and she's like, oh, I have this great idea, let's put these surgical socks on you. And so just like letting them know, I think a lot of people know about POTS now. Even just a few years ago when I had my daughter, I feel like less doctors and nurses knew about it. Now I think it's becoming much more well known. I think it's out there a lot more, and so people know about it. Doctors know about it, nurses know about it. If they don't, of course, make sure you advocate for yourself or ask for someone who does know. But informing your medical team, letting your doctor know, from before you get pregnant until delivery, letting your nurses know. If you have someone else deliver your baby or whatever, my doctor, who's been with me through all my pregnancies, has delivered all of my babies, plans to deliver this one. So he already knows me. He knows all my issues. He's been there the whole time. And so having your medical team on your side, I would say, is huge because, like I said, everyone's different. Maybe yours does affect you. Maybe you have something else that comes up. So just making sure that everybody knows what's going on, what you're nervous about, even if it's really not a big deal and everything's actually fine. If you're nervous about it, talk to someone. Tell the doctor, tell the nurse, call someone else in to talk about how you're feeling, because that's going to help the most. And I have one more question. How does your migraines affect your pregnancies? I would say the big thing with my migraines is just that I can't get heavy pain medication if they get really bad. I had one right before I got pregnant where I ended up in the ER, got the whole migraine cocktail thing, and that of course is not safe for pregnancy. I have been to the ER once during this pregnancy due to just really bad flu. Nothing related to my chronic illnesses, of course, but I got the flu really bad, couldn't stop throwing up, and I ended up in the ER, and they really couldn't give me anything but nausea meds, even though I was in a lot of pain. So that would be the hardest thing, is that you just can't take certain medications because they're not safe for the baby. So for me, I luckily have been going to an upper cervical chiropractor and having a lot of success there with my migraines. Started that almost 2 years ago. It's taken me much longer than most people to heal from that, but I will say that this pregnancy and this year in particular, it's healed a lot better. It's getting a lot better from those adjustments, and so because of that, might have been better. But had I not been going to those, I think it would be a lot more of a struggle because I can't take much except Tylenol and maybe some caffeine and a few things like that. So when I do get a migraine, I'm kind of just out, and I just have to really baby myself and really take control and do my best to keep my eyes closed, keep an ice pack on my head, take some Tylenol, get help with my kids. Like, I kind of just have to go all out because I don't want it to get to a point where I would even consider doing heavy pain medications as a pregnant woman. And I'd say the biggest thing when it comes to chronic illness and pregnancy is the medication. Like, if you're on medication, you got to figure that out first. Make sure you either can take it during pregnancy. If your chronic illness affects pregnancy in any way, there's the medication that you can take to help, prevent issues, as well as if you're taking a medication that's not safe for pregnancy, that you find a way to get off that before you get pregnant. Figure out a different solution. I don't like to take medications. I get a lot of side effects from medications in general, so I've tried a lot in the past. I really don't take a lot, so it hasn't affected me very much, except in the sense of like those severe migraines. I would say is the only time.
Close your eyes, get some rest. I'm by your side. Lay your head on my chest.